Okay. Right. Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you. Today on this platform of classical corrections, we have Mohamed Ibrahim Sharif from Coonoor, Tamil Nadu, India. He is a doctor by profession and is preparing for his OET, medicine specific occupational English test. This is the speaking test and we are doing with the warm-up session. Hello, Mr. Mohamed Ibrahim Sharif.
Hello, sir.
Are you ready for the test?
Yes, sir, I'm ready, sir.
Okay. This is the daily dosage, profession-specific speaking materials, and the medicine profession-specific speaking tasks. Dr. Sharif, can you please tell me something about yourself in 3 to 4 sentences?
Sure, sir. I take this opportunity with immense pleasure in introducing myself to you. My name is Mohamed Ibrahim Sharif. I'm from Coonoor town. It's in a beautiful hill station called Nilgiris. It's located in the southern part of India. I'm a doctor by profession and I speak Urdu, Tamil, Malayalam, Kannada, and English, of course.
Why did you choose medicine as your profession?
Well, there were various reasons, but one of the main reasons is as a kid, I used to go to the hospital quite a lot of times. Nothing serious, but due to trivial issues like common cold or just the flu during the seasons. So when I went there, what I observed was that the doctors, the nurses, the paramedics, they used to work with so much dedication, love, and care for the patients, which really made me think of it as something I might do in the future. So this was one of the main reasons.
What is your fundamental reason for taking the occupational English test?
Well, it is my dream to work and practice in the United Kingdom as a doctor. And the first steps in order to go to the UK is to do the occupational English test. And next up comes the medicine-based exams, and then later the registration and so on. So this is the first step, and hopefully everything goes well.
Which country is your most favorite destination for migration and work?
Well, as I've mentioned in my earlier answer, that ever since I was a kid, I was really fascinated with the United Kingdom. I'm a huge football fan, and most of the brilliant and the amazing teams, they play in the United Kingdom. So as a kid, I've always wanted to catch them live one day. And also in terms of profession, working there as a doctor, I've heard from my friends, my family, my seniors that there's a lot of prospect and there's a lot of scope as a doctor in the United Kingdom.
Comment on the special qualities of the contemporary.
Well, I've worked with quite a few doctors. Yeah, well, I've worked with quite a few doctors in the past years, and what I've noticed in all is that each of them possess a quality which makes sure there is 100% care provided to the patient. So no matter how stressed they are in their lives, no matter how many problems they are facing in their lives, they always make sure not to reflect it in the workplace and to provide the utmost care and love they can to the patient and give the best treatment possible.
What is the regular routine of an ideal doctor?
Well, being a doctor myself, I would like to talk about my routine. So it involves getting up early in the morning at around 5 or 6, completing my morning prayer, going for a small jog. Sometimes if it's raining outside, I just prefer doing exercises inside my house. And then I go to the hospital quite early before the senior doctors arrive, make sure all the notes are completed, all the investigations are completed. And then after the senior doctors arrive, the rounds take place, which usually lasts for around 2 to 6 hours, depending on the senior doctor, whoever comes for the rounds. Then after the rounds are done, we just follow up with the work and the duties provided by the senior doctor. And after everything is done, we call it a day.
As far as your profession is concerned, who is your role model?
Well, up until 12th standard, some people call it PUC. I never really had any role model as such. I just had some vague role models, like few of them I see in the hospital here and there, but I never really had a specific role model. The first role model, when I saw the person, I realized was in my second year of MBBS, when I came across this person. His name was Dr. Mukhtar Ahmed. He is a professor in general medicine. What inspired me most about him, what I liked most about him, was the way he used to communicate with the patients and his vast knowledge he has in the topic. So he's an amazing person, even inside the hospital and even outside the hospital. And he's an absolute gem of a person, I'd say. And one day I'd aspire to be at least half of what he has achieved in his lifetime.
Right, that's very nice talking to you, Dr. Sharif.
Likewise, sir.
And thank you very much for the wonderful session.
Thank you, sir.
Have a nice day.
You too, sir. Thank you.